My name is Dr. Wentworth, and I'm a chiropractor and certified athletic trainer. I've been up in the New England area for the last 12 years, and one of the things that makes our practice unique is we've introduced evidence-based, scientifically proven machines for neck and back pain. Medix machines, we have the low back and we have the cervical machines here, were developed by Arthur Jones. He put $400 million of his own money in developing these machines. He started with Nautilus and then sold that and decided he wanted machines that were medically proven for neck and back pain. We've had fantastic success with these machines here. I've had 2 back surgeries myself, and I discovered these machines in Atlanta, Georgia after my second back surgery. They are very specific. He held over 30 patents on these machines, and the exercises that you get with these machines you can't duplicate in any other gym or with any other equipment. I've had 2 back surgeries myself. This graph here, okay, what I like about this is it shows the orange color, which is the norm. Okay, these are based on independent studies out of the University of Florida Medical School and the University of San Diego Medical School. They're built on normative standards of people who they brought off the streets who never identified themselves as having a back problem. The orange is the norm. The 2 lines above and below are the standard deviation above and below. Sadly enough, this is my score when I first got the machines up here and started working with them. I retested myself August 24th, and this is where my graph is today. So I improved from basically the bottom, zeroing out, okay, up to the norm.
My name is David Glazebrook. I've been a patient here at Sports Spine and Rehab with Dr. Wentworth for about 2 years now, actually over 2 years. I spent 13 years in the Army, active duty. I'm an Iraq War vet. I left the service because of multiple back surgeries and issues with the back that kept me from doing my job anymore. I had went to physical therapists in the Army with no results. I came to Sports Spine and Rehab just over 2 years ago, and she started me on this program with exercise and the Medix. She did a first initial test on me, which my back was rather weak, and I couldn't obviously lift for anything of my size and age. After probably about 6 solid months, we started seeing noticeable improvement to the point where about a year after I started coming here, where I was on some pretty strong pain medication for the back, I was off the pain medication. The subsequent year, I continued to work on the Medix machine and get tested, and my strength improved to the point now where I have virtually no back pain. I hike regularly, I do yoga regularly, I ride my bike regularly, and my life is pretty much back to normal as it was before the back issues started.
By doing a very specific exercise in a safe environment, you can increase that back strength. I don't consider myself having a back problem. When I get that little twinge, I give it all the respect that it deserves. And unfortunately, like everybody else out there, I have this here every day at my disposal, and I probably do not use it as much as I should. We had a woman call today who I think we've seen 3 or 4 times. She was a referral from one of the orthopedic practices, and she said she was just getting ready to call us because she wanted to tell us that she had the first 2 days of no pain in the last 20 years. Okay, so she was extremely pleased with that. Okay, she's teaching yoga, and she hasn't been able to get that relief. Her meds, she's almost off her meds right now, and if we can keep her in that same pattern, okay, through this program, I think she'll be happy with the results. The Medix protocol is a 12-week program, and it's recommended that we do it twice a week.